Hey everyone, welcome back. If you're watching this, chances are you're preparing for your AHPRA Oral Exams, and look, let's be real, it can feel pretty intense. But don't stress, because in this video, I'm going to break it all down for you. First, let's quickly go over what this exam is actually testing. The AHPRA Oral Exam is the final step before you fully become a registered pharmacist, and it's designed to assess how well you can apply your knowledge in real-world scenarios. It's broken down into three key sections. The first section is primary healthcare. This tests your ability to handle common healthcare conditions, recommend over-the-counter solutions, and give lifestyle advice. Section 2 is the legal and ethical practice section. You'll be tested on pharmacy laws, professional obligations, and ethical dilemmas, and how you respond to them. And then the third section is the problem solving and communication. Now, this is where you're demonstrating your clinical decision-making skills and your ability to explain complex information to patients and how you gather those information from your resources. Now, we're not going to go through every single piece of content you need to study. Instead, I'm going to show you how to approach each section, what the examiners are looking for, and how to prepare effectively. And just a quick reminder, this is just a small taste of the resources that I provide through PharmacyDownUnder to help you proceed and succeed. If you want more structured guidance, practice cases, live workshops, check out the school community. There you'll also find all of our ebooks, newsletters, oral exam, written exam prep, all linked below. All right, let's jump in. Now, section 1 is primary healthcare. This section is all about assessing your ability to handle common healthcare conditions and provide appropriate treatments. Think of minor ailments, over-the-counter medications, and lifestyle advice. Now, the key to nailing this section is having a structured approach. You don't want to jump straight to recommending a product without fully understanding the patient's needs. Here's an example. A patient walks in asking for something to help with hay fever. You should immediately think, what questions do I need to ask? So is it seasonal? Is there any triggers? Is there any other medications they're on? What are the most appropriate recommendations? Antihistamines, nasal sprays, lifestyle advices and lifestyle changes they could approach. And lastly, how do you sort of communicate this information clearly to the patient without using jargon? Now, the best way to sort of prepare for this is generally getting your hands on the medications themselves. So making sure that you're not just learning from a book. You need to get in the pharmacy, you need to touch the items, read the instructions, look at the packaging, see the differences between all of the solutions available in the community, making sure you're engaging with your patients on a regular basis in the community to practice, and don't neglect the power of non-pharmacological therapies when providing solutions for your patients. Now, a great way to practice this is by going through real-life scenarios, of course. And inside my school community, we actually do go through case-based discussions on these exact topics. So we go through step-by-step, breaking down all of your responses, and we find that by doing that and by practicing regularly, you're able to refine your technique, refine your strategy, and then your knowledge of the items will not only become more proficient and more in-depth, but in the real world, once you do get registered, you'll be way more confident in terms of recommending for any condition that you may encounter. Now, the next section I want to cover is legal and ethical scenarios. This section is where a lot of interns mess up. This is usually not because they don't know the laws, but because they struggle to apply them into real-life scenarios. Now, you'll get scenarios that test your understanding of dispensary regulations, refusal of supply, patient confidentiality, professional obligations, and a lot more. This section is only 5 minutes, and it's not in a role-play scenario, so you need to be efficient and you need to get straight to the point. So, for example, say a patient comes into the pharmacy demanding an early refill of a controlled drug, for example. And all the question will ask you is, what do you do? Now, your step 1 should be check the legal requirements. Are you even allowed to dispense early? Step 2, assess the situation. Is there a genuine reason for early supply? Step 3, communicate your decision professionally and offer alternative solutions. If you're not confident in handling these kind of situations, I've got an ebook in our community pharmacy essential section that covers these ethical and legal dilemmas, and with sample responses that will really help you in these situations, especially if you feel stuck. it's really, really important to have something like this to make sure that you have something as a backup in case you get frozen on the exam day and you're not sure how to proceed. Now, it's really, really important that when it comes to the legal and ethical sections that you're not waffling. The major error that I know a lot of students do is that because they're not confident in their knowledge or they're not confident in the way they're approaching the question, they end up sort of waffling and not really being specific in terms of how to approach a problem and how to sort of give that decision making that you need in order to get the marks that are necessary. Now, it's very, very important to make sure when you're answering the question, you go straight into it and say, this is what the legal concern is, this is what the ethical concern is, and this is what I'm going to do now. So it's very, very important to be very, very clear and to say what is yes legal and what is no illegal. Because if you say, oh, this could be ethically ambiguous, or if it's legally ambiguous, you won't get the marks for it and you could possibly fail. Now, it's really, really important as well that after addressing exactly what the issue is to the marker, you need to specify how are you going to tackle the problem. So what are you actually going to do? So let's go back to that case of that controlled drug early supply. So what are you going to do in that situation? Do you simply just refuse the request? Do you recommend them go to the hospital? Do you recommend them to maybe get in touch with the GP? It depends on what time of day the situation's happening, if it's early in the morning, or in most cases late at night when everyone's closed. So there's many, many different factors that we need to take into account, and you need to make sure that you have a game plan and a logical and realistic, beneficial sort of game plan to cover yourself as the pharmacist legally and in terms of your due diligence as a pharmacist, but at the same time to make sure if there is a genuine concern for someone's health and safety, that's also being addressed as well. Now, of course, if we're talking about the early supply of a controlled drug, of course we have to refuse it if there's no other sort of context to the situation and take another route. So say, for example, the patient's misplaced the tablets or their dosage has been adjusted, but there's been no script to reflect that, they might need to head back to the doctor's office or even to the hospital to get some help. And a really, really important note as well when it comes to any of these sort of cases is that we need to make sure we're documenting everything. So what that means is any patient interaction, any staff interaction, or pharmacist-doctor interaction, good or bad, it's very, very important that we're recording and time stamping all of these conversations. So if anything does happen down the line, that you are covered with the paperwork in case something does go wrong. Now, the last section for this section, or the last phase of this answer for the legal ethical section, is to talk about the prevention. How are you going to prevent this from happening again? So, for example, if it's a staff error, how to train all the staff, how to teach and re-educate all the staff and reinforce education of all the new onboarding staff members about things like this and how to prevent that from happening. Or, for example, educating the doctor if it was a doctor situation, or educating the patient. It's very, very important that education should be your focus, and the safety and the health of the patient as well is the priority. So other than that though, like I've said in the very last dot point, document all interactions. And if there is any malpractice or any potential harm done, we need to mention, and in the exam you must mention this, but this is also advice for real life, you must report it through your professional indemnity insurance, whichever one you're with. That's very, very important, and that goes for real life, not just the exams. Now, we'll jump into the last section of the oral exam. This is the big one. It's the problem solving and communication section. So this one is really going to tell you whether or not you're really ready for day-to-day community pharmacy interactions. Now, this section here is there to sort of test your ability to analyze complex situations, make clinical decisions, and not just that, but it really tests your ability to communicate clearly, not just with the patient, but with healthcare professionals as well. So you might get like a question where you have a situation, for example, a patient is coming to the pharmacy and they're taking like a new medication and they might be feeling a bit dizzy, and all you'll be given is that prompt. You'll be given maybe an image of the prescription, maybe a dispensing history, and potentially some recent blood test readings. And what's unique about this section is that you do have the ability to actually role play with the patient and also role play with the doctor that's relevant as well. So, for example, if the patient is bringing you in a new script from a new doctor, for example, you can actually call the doctor in role play, that is, and speak to them directly to communicate any concerns and any recommendations that you recommend as a replacement, for example. So the main goal and the main purpose of doing this is in real life, we're going to be facing a lot of things with patients, but at the same time, we're also going to be facing a lot of situations where interacting with other healthcare professionals, whether it be a specialist or a GP or a dentist or a physiotherapist, podiatrist, or even an optometrist as well. So it's really, really important for us to understand how to approach our communication skills and how to identify things clearly and explain things succinctly. So it's all well and good to be able to use your resources to access, the AMH or the EMIMS or wherever it could be to figure out what the issues are. But it's really the pharmacists that on the higher end of the spectrum that will be able to communicate clearly to that healthcare practitioner in terms of what the area is, and at the same time providing a recommendation so that the GP is also confident that you know what you're talking about and that they will be confident in delivering that. Confident in you rather to deliver that information back to the patient. So I think it's very, very important that we understand that using resources is fantastic, and knowing how to figure out what interactions there are and your pharmacological knowledge is fantastic. However, at the end of the day, this section of the exam is a problem-solving case, and that also includes a massive section on communication. So I think it's a very, very important thing, and probably one of the biggest takeaways I usually recommend for all pharmacy sort of interns is to really sort of focus on communicating on the day-to-day, making sure you're slow in your speech, enunciating properly, making sure you're using the right jargon when you're speaking to the doctor versus more colloquial language when you're speaking to the patient as well, to make sure that you can get that information across as simply as possible and as effectively as possible. Now, when it comes to this situation or this part of the exam, it's actually completely open book, the 20-minute section. So you have 20 minutes to interpret the question, interpret the problem, go back to your offline resources. So you can use software, but it has to be disconnected from the internet. So EMIMS, AMH, APF, whatever you want really, to be honest with you, as long as it's offline. And to deduce the solution and deduce a recommendation, and to reach out to the doctor, confirm the situation, and confirm that the error that you've pointed out is correct, and to agree on a replacement, and to go back to the patient and to explain the situation and counsel appropriately, all within 20 minutes. So now it does seem like a lot of time, but to be honest, a lot of pharmacy students and interns really struggle because they're not efficient at time management. So that's a really big problem, especially in the day-to-day community pharmacy setting nowadays. Life is busy, work is busy. It's very, very hard to sit down and have a proper chat with some patients, especially if the way pharmacy is going, especially in busy metro pharmacies. I completely understand that. So that's why it's really important that, if you jump into our school community, we do have like mock exams, mock oral sessions where we go through step by step in terms of, how to approach these exams, how to approach these problem-solving questions in particular, and how to really break down the solutions. Now, going back to the example of that script coming through that's causing that patient dizziness, now you could just say, a weak response in saying, oh, this is just a side effect, and, the patient can be sent back to the doctor. What you're meant to do from the pharmacy intern side is that you're meant to interpret the prescription, interpret the patient's symptoms by information gathering. And on top of this, and analyzing their full medical history, analyzing if there's any drug interactions, see the severity of the dizziness, for example. Could this be something of concern, or this could be lifestyle related? What do we need to know in terms of reaching out to the doctor and interpreting a solution? And what do we need to gather from the doctor to interpret a genuine solution for the patient? So it's a multi-layered approach, and it's something that I feel like can't really be crammed. It needs to be something that's practiced like a muscle. We need to train it, and with progressive overload, just like a muscle, it's going to get stronger and stronger and more efficient and more proficient. So really, really important to make sure that you're practicing, and with your preceptor, with your fellow interns, with your colleagues, family, and even through the PharmacyDownUnder PharmWise school community. We have about 80 to 90 people on there now, actively collaborating and actively practicing with one another in terms of really locking in those fundamental skills to really excel in this exam. Now, lastly, on the actual exam day, so what do we do on the exam day itself? We've done all the prep, And if you go in stressed and flustered, all that knowledge is just going to go out of the window. So here are the key strategies you need to keep in mind. So number 1, it's going to be managing your time. Number 2, stay professional. And 3, think out loud. So let's start from the top. Managing your time. You don't need to rush. You don't need to over-explain either. You need to be concise and get straight to the point. It's super, super important. Waffling, especially in section 2 and in any of the sections really, is really going to make you fail faster than ever. Because the thing is, if you're waffling, you're giving extra information that's probably not relevant, and some of that information can sort of push you in the wrong direction and actually push you into the section, or rather direction, that's actually failed, which is a failed response. So you've got to be very concise, don't waffle, and just keep it moving. Now, stay professional. Even if you're unsure, stay calm and structured in your response. Make sure you're confident, make sure you're clear, make sure you're methodical and really patient. Don't rush your responses. Don't fall for the trap of verbal diarrhea and throwing jargon out the window. You got to be really patient, really methodical, and very calculated with your response. And at the end of the day, you need to remember, this is really an assessment of your ability of being a competent pharmacist. We're not asking for you to do a PhD thesis of those case scenarios that you're receiving. We just need you to be clear and to be confident and to give us a succinct solution that's not going to harm the patient. That's the most important thing. As long as the patient's health is maintained and improved or addressed, that is the most important thing. At any point that we're causing any harm or potential misadventure for the pharmacy or for the patient, then that's an instant fail. Now, the last thing is think out loud. The examiners want to see your reasoning, so don't just sit there silently trying to think of the perfect answer. Like I said, you need to be a very clear communicator in this exam. You need to speak your mind and understand that they're listening. So we're not writing anything on the paper. They're standing in front of you, listening to you and every word you say. So really important to take advantage of that opportunity and make sure you explain your thoughts out loud. And honestly, speaking out loud really allows you to deduce much faster. And you sort of, once you hear what you're saying, you'll be able to know what's right, what's wrong a lot faster than writing it down or just thinking it in your head. Now, you've got to remember as well, confidence is key, fundamentally. If you put in the work, you'll be fine. And if you want a more structured practice, check out my oral exam workshops. We run through real cases and instant feedback given to all the students that are participating. Now, it's really important though that these workshops are geared to sort of really boost your confidence. And there's nothing wrong with stuffing up the first time, the second time, the third time. It's really important that you are doing the work, doing the drills, going through practice scenarios and really pushing yourself and not doing the easy questions and really going out there and doing the ones that are really tricky and hard. Now, the next steps. What do we do from now? So that's a full breakdown of the AHPRA oral exams and a sort of a basic summary of each main section and how to prepare for it the best. Now, hopefully that gave you a really good starting point and a general idea of what's expected and how to really sort of smash it out. Now, I hope you found it really helpful because what we've been doing at PharmacyDownUnder is that we have been providing a lot of free resources for pharmacy students and pharmacy interns, and even an exclusive pharmacy intern community, which is really starting to grow as we speak. So we're giving away a lot of value here, a lot of really good lessons that you can use, not just in your internship, but in your actual clinical pharmacy practice career. So it's really important that, click the links below. I want you to have a look at it. I want you to get a feel of what's involved and the support that we provide at PharmacyDownUnder. And I want you to know that, if you're serious about acing these exams and not just passing the exams and getting registered, but launching yourself in the right path in your career in terms of pharmacy and beyond, you need to click the links below and have a look. It's a really good community, really great people in there. There is a leaderboard, competitions, giveaways. There's going to be more content being posted every fortnight, live calls and sessions, and hopefully real life meetups as well, and even a mobile app that you can download on your phone so you can take your pharmacy training everywhere. Now, other than that, look, please feel free, drop a link down below. If you have any questions, click on the links, click on our ebooks, join us on Instagram and even on our newsletter as well. And if you have any questions or if you have any queries, please feel free and write a comment below. Other than that, thanks so much and all the best for your studies. I'll see you on the next one.